I am a Senior Director in Radiation Oncology in Max Healthcare. The connection between cancer and radiation is very interesting, and warning, it can be confusing for everybody. Well, cancer can be caused by radiation. It's not unknown to have cancers caused by radiation. So what is cancer actually? Cancer is basically an unstable DNA which is continuing to divide, proliferate, and it somehow suddenly becomes uncontrolled, and that's what is cancer. And more it gets uncontrolled, it spreads in the other parts of the body. That's what is cancer. What does radiation do to cause it? Well, radiation can possibly, not in every case, but in some few cases, can increase the instability of the DNA and can induce cancer. So that's the relationship of causation. But this is the least important relationship. The most important relationship between cancer and radiation is that of therapy. Radiation is used for therapy of cancers. Now, I'm sure this is the place where everybody is getting confused. I'll tell you what I mean by that. This same radiation which can disrupt the DNA can actually kill the DNA. So if you are modulating the radiation, if you are focusing the radiation onto the fast dividing cells with the right energy is very important. Otherwise, X-rays can be just scattered radiation here and there. With the right energy and with the right plan, when you're focusing it on the cancer, the DNA of the cancer cell, it gets disrupted. The moment the DNA of the cancer cell gets disrupted, it begins to die. Either it can die straight away, or it can cease to divide further, and then it will die in the next cycle. So that is what is the principle of radiation therapy, and a very intricate relationship between cancer and X-rays. X-rays are the biggest enemy of cancer. In fact, there was a study from All India Institute where 80% of all patients ultimately required radiation therapy. So, it's a very, very important modality for cancer therapy. And causation, rarely. Someone can ask me now, or can think that what radiation we use for therapy, can that cause cancer? Yes, it can, but that is very, very, very rare. That is rare to the tune of 1 in 10,000 cases who survive for a decade or two. It's becoming less and less common now. But yes, it is a possibility, but that is not a possibility enough to not use radiation therapy for cancer, because first you survive and only then can you get the second one, and that too is so rare. So this is a very complex love-hate relationship between radiation and cancer. Radiation therapy is used for the treatment of cancer, and what we do is we pair radiation with other modalities. So either we give radiation along with chemotherapy, that is called concurrent chemo-radiation, or we give radiation in a format where you try to shrink the tumor first and then you kind of do surgery for it, that is called neo-adjuvant radiation. Or we can do radiation therapy to clear out the cells that have been left after surgery, and that is called adjuvant radiation. I can give you some examples. It cannot be an exhaustive list, but when you give radiochemotherapy together, that is for head and neck, throat cancers, mouth cancers sometimes, but throat cancers most of the times, voice box cancers, lung cancers, and you can do that radiochemotherapy together for esophageal cancers. You do radiation therapy in the anterior manner, that is for the before surgery. You can do it for rectal cancers. You can do it for many other cancers. I'm just trying to give you some examples. And then in the adjuvant for many other cancers, even mouth, throat cancers sometimes will need adjuvant radiation, that is after surgery. And lung cancers will require sometimes after surgery. Then, your soft tissue tumors, your sarcomas, abdominal cancers so many times require radiation after surgery, and so on and so forth. There is also one very interesting use of radiation only for therapy. For many cancers, radiation therapy alone can be used for therapy. A very notable example can be that of the vocal cord cancer or the prostate cancer. Just be done with radiation. That's what is very interesting.